The epidemic of pet obesity can fly under the radar, but it is a disease that must be taken seriously. Obesity is likely the #1 obstacle to health and well-being for the millions of cats and dogs that we welcome into our homes as companions. A recent survey of veterinary professionals in the U.S. estimates that 56% of the pet dog population and 60% of the companion cat population is overweight or obese. Applying these percentages to the overall number of pets in this nation suggests that approximately 50 million dogs and 56 million cats are overweight or obese. While cartoons may depict pudgy pets as cute, cuddly, or comedic, there's nothing funny about excess body weight. Chronic obesity in pets shortens their life expectancy and diminishes the quality and comfort of their lives. A recent study of Labrador retrievers showed that fit and trim, lean dogs live an average of 2.5 years longer than their chronically overweight peers. Obesity can cause or exacerbate health issues within multiple different body systems. Obvious health implications include musculoskeletal diseases, such as reduced mobility, arthritis and disc disease, respiratory conditions, often manifesting as chronic coughing, metabolic diseases such as diabetes mellitus and hepatic lipidosis in the cat. Research also indicates obesity in heightened risk for skin, heart, liver, and kidney disease. Obesity is also proving to be a risk factor for numerous cancers. What is most shocking about the crisis of pet obesity in our nation is that in the majority of cases, it is a problem of our own creation. Yes, there are medical conditions that make it nearly impossible to maintain a pet at their ideal body weight. Look no further than hypothyroidism in the dog. And yes, there are medications for other diseases which have side effects that wreak havoc on weight management in the patient. A perfect example is the anticonvulsant phenobarbital that we use to manage seizure conditions. But patients with these conditions or taking these medications are in the minority. The vast majority of overweight and obese pets in this nation are simply overfed. That is a simple fact. What is not simple is breaking down the complex, emotional, behavioral, and psychological components of the human-animal bond and our society's disordered relationship with food that has resulted in our culture where we accept this dire epidemic of our own making. We have come to accept overweight pets as the norm, and in many cases have lost sight of what ideal body condition even looks like in pets. Animals should have nice, trim waists, visualized as either a nice tuck in front of their hind limbs when viewed from the side, or a lovely hourglass shape when viewed from above. While we don't want to see ribs protruding from a dog's side, we do want to see a gentle ripple or undulation where muscle and skin passes over the rib cage. Ask the average American to comment on dogs and cats who are at ideal body weight, and they will likely exclaim, "Oh my, they're too skinny." As a pet owner, where does one begin with tackling this crisis of well-being? The first step is admitting that the problem exists. And the second step is accepting ownership that you are part of the problem. When you are ready to tackle this issue, I encourage you to schedule an appointment with your veterinarian. We have a wealth of knowledge, strategies, advice, and tricks of the trade to guide you and your pet on a successful weight loss journey. I am Dr. Kate Capel, a veterinarian at the Perry Veterinary Clinic, and this video is brought to you by Animal Friends of Wyoming County. Thank you for watching this video presented by Animal Friends of Wyoming County. Please like this video, follow us on social media, and give a tax-deductible donation through our website, animalfriendsofwyco.com.